My name is Sylvie Harrison. I am the manager of the RadioCraft team at Farm Radio International, and I will be facilitating the webinar today. We're thrilled to be able to put on this event and have this discussion. So thank you so much for joining us. Our webinar today, Agile Communication and Community Engagement for COVID-19 Resilience, the next phase. So I'm looking forward to some really exciting and interesting presentations and discussions with some interesting speakers. The webinar will be in English, but with simultaneous translation in French. So in order to hear the language of your choice, please go to the bottom of your screen. You will see an icon that looks like a planet or a globe, and you can click on the interpretation icon and you will be able to choose either English or French according to your language of preference. I will say that in French so that we are able to switch languages for everyone. Donc bonjour, bienvenue à chacun d'entre vous. Je suis Sylvie Harrison. Je suis la gestionnaire de l'équipe des métiers radiophoniques à Radio Rurale Internationale et je serai votre facilitatrice pour le webinaire. Je suis très heureuse d'être avec vous aujourd'hui et de pouvoir avoir cette conversation, cette discussion avec des panélistes extrêmement intéressants. Donc, merci d'être là avec nous. Le webinaire d'aujourd'hui, donc pratique de communication agile et engagement communautaire pour la résilience au COVID-19, la deuxième vague. Pendant ce webinaire, les présentations seront en anglais. Par contre, il y aura de l'interprétation en français, de la traduction. Vous devez choisir votre langue de traduction. Donc, sur votre écran, en bas de l'écran, vous devriez voir un icône qui ressemble à une planète ou un globe. Donc, un icône interprétation. Cliquez là-dessus et vous allez voir soit English ou français. Donc, choisissez votre langue d'interprétation et ça vous permettra d'entendre le webinaire dans la langue de votre choix. Excellent. So hopefully everyone is clicking away and choosing their language of interpretation. Welcome once again. We'll jump right into this webinar. Again, my name is Sylvie Harrison. I'm the manager of the RadioCraft team at Farm Radio International, and I will be your host for today. And for those of you joining us, once again, a reminder, the webinar will be in English. We have simultaneous translation in French, and you have to choose the language of interpretation that you would like. You can find that, there's an icon at the bottom of the Zoom screen that says interpretation, and you can choose the language of your choice. Donc, pour tous ceux qui n'ont pas choisi leur langue d'interprétation encore, un rappel que le webinaire se fera en anglais. Par contre, on a la traduction en français. Donc, vous avez tout simplement à choisir en bas de votre écran, il y a une icône qui ressemble à une planète ou un globe, interprétation. Cliquez là-dessus et vous allez voir soit English ou français. Choisissez votre langue de choix et vous allez entendre le webinaire dans cette langue. Donc, je vais maintenant aller du côté anglophone et vous allez entendre la traduction. Excellent. I think we're ready. So today's theme is a big one. The coronavirus pandemic has changed the development world in so many different ways. And if someone had told us a year ago what our work would look like today, I'm not sure that we would have believed them exactly. So now, a year into the COVID-19 pandemic, well into the second wave, with new strains and vaccines being distributed, there is still fear, vaccine scarcity, questions about distribution, and so many more things that we need to be thinking about. In the context of rural communities in sub-Saharan Africa, these factors pose unique challenges. So this is what we're going to get into today. And to do this, we have a group of individuals who are tackling these issues in innovative ways. And this is, we need to keep this in mind, at a pace that we have rarely seen before. So our speakers today, we will have Hannah Tellier and Ben Fiafor from Farm Radio International, and they will talk to us about how information and communication technologies were able to respond to the needs of rural African communities during the COVID-19 pandemic so far. We will hear from Salakshana Gupta from Vmware, and she will talk to us about what digital engagement tells us about rural African communities at this stage of the COVID-19 pandemic. We will also hear from Mariana Palavra from UNICEF, the West Africa Risk Communications and Community Engagement Group. And she will tell us about the messages that we've heard from community engagement. And finally, we will hear from Andrew Pattison from the World Health Organization, and he will talk to us about vaccine hesitancy, digital channels, and of course, misinformation. So after their presentations, each speaker will have a few minutes to speak. And after the presentations, there will be a panel session where our speakers will try to answer some or all of your questions and really highlight the next steps that they think we should take as we move into the next phase of the COVID-19 pandemic. And we want to think about questions like, how can the international community work with local actors to reach rural African communities, using these agile communications and community engagement to create COVID-19 resilience? We also want to think about, well, what are the next steps in communication for development? And what does this next phase hold for us? So these are some of the questions and themes that we're going to discuss and answer some of those questions today. Once again, just a reminder, the webinar will be held in English with simultaneous translation in French. So if you have not chosen your language of interpretation, please do that now. At the bottom of your screen, you will see an icon. It looks like a planet or a globe. You can click on that and either choose English or French. Donc, un rappel que le webinaire se déroulera en anglais avec une traduction simultanée en français. Vous devez choisir votre langue d'interprétation pour entendre la présentation dans la langue de votre choix. Donc, vous pouvez aller en bas de votre écran. Il devrait y avoir un icône qui ressemble à une planète ou un globe qui dit interprétation. Et vous devez choisir soit English ou français selon votre choix. Comme ça, vous allez entendre la traduction ou la présentation dans la langue de votre choix. Excellent. Introductions are almost complete. I will hand it over, really to get us started, I will hand it over to the Executive Director of Farm Radio International, Kevin Perkins, for some words of introductions and a welcome. Over to you, Kevin.
Thank you, Sylvie. It's my pleasure and privilege to welcome all of you to this webinar on Agile Communications and Community Engagement for COVID-19 Resilience. Thank you for joining us. This is the second in what will be a series of webinars that explore the role of communication, information, and remote-led methods in global development challenges. I'm excited by what is to follow. I'm so pleased that Salakshana Gupta of Vmware, Mariana Palavra of UNICEF, and Andy Pattison of the World Health Organization, conjoined with two of my colleagues at Farm Radio International to explore the role of communication and community engagement in responding to the COVID-19 crisis. There is much we can learn about the initial response to the urgent information and communication needs created by the pandemic, and there is much to consider and prepare for as we work toward the vaccine-powered end of the crisis in the hopefully not too distant future. Last year, when word of the mysterious coronavirus was just capturing our attention, Farm Radio International was putting the finishing touches on a new 5-year strategic plan. As a notorious boxer once said, everyone has a plan until they get punched in the mouth. And COVID-19 was a whopper. It brought huge changes to the way we work, mostly from home, using remote distance methods, with radical new health and safety protocols and constant concerns for the well-being of our colleagues and families. And it changed the work we did, with heightened and urgent need to respond to the pandemic and its long list of collateral impacts. For Farm Radio International, it meant reaching out to our partner radio stations to make sure they had the information and support they needed to offer their listeners accurate, timely, fact-based information about this new health crisis. It meant helping our radio partners connect with their peers to understand how their communities are being impacted and the information services they would need, while keeping themselves healthy and whole in the face of the pandemic. COVID-19 will also require changes in what we do next, as we all work hard to wrestle COVID-19 to the ground and help communities, families, and nations recover what they lost. Communication and community engagement has and will continue to be a critical part of our collective success in doing this. Now, Sylvie, I'm going to hand the mic back to you now and resume my preferred role as a keen listener. Thank you again, everyone, panelists in particular. Looking forward to this.
Thanks, Kevin. So I'd like to welcome our first speakers. On behalf of Farm Radio International, Hannah Tellier, who is a program assistant with us, and Ben Fiafor, our country representative for Ghana. Hannah and Ben were closely involved with our COVID-19 response project that began almost exactly 1 year ago. Hannah and Ben, over to you.
Thank you so much, Sylvie. Next slide, please.
Midhusi mar corona ok en kum mar tho. Atamalo 80 mag jogo eko ma oseyudi gi midhusi mar corona osechango. Kata kamano, ginyalo romo kod pek e ngimagi. Oganda nyalo chako kwedo jogo eko ma midhusi mar corona osemako. Kata kamano, loso marach kuomgi kata timonegi timbe mochido ok ber kata matin. Timbegi eki nyalo mono oganda dhi e pim. Akwede kuom jogo eko ma osechango kwa tuo mar corona nyaka rum sani. Wajiwre waduto kendo wamiere arita ka wakedo motegno gi midhusi mar corona. Gini omako waduto.
Thank you. This is what it sounds like when radio reaches listeners with vital information about COVID-19. We thank Radio Kodakena in the DRC for this radio spot, which was written by Farm Radio International, then translated and recorded in Swahili by broadcasters. This clip is one small example of the power of radio in a time of crisis. Unlike other mediums, radio can reach rural African communities despite restrictions to deliver life-saving messages accessibly and at scale. Next slide. Thanks to the generous support of Global Affairs Canada, Farm Radio International supported our network of more than 1,000 broadcasting partners in 41 African countries to serve their listeners during the COVID-19 pandemic. Our response was made up of 4 key elements. First, our resources, which are informed by experts, written by African journalists, and shared with our network. These help broadcasters to create and inform high-quality programming about COVID-19 and continue to work safely in the face of the pandemic. In this project, we created more than 40 radio resources and counting. Second, we offered broadcaster hotlines in 12 countries, assisted by the services of Vmware. Radio broadcasters who called the hotlines heard recorded information about COVID-19 and were given the option to record their questions about the pandemic, which were later answered by local and international health experts. This service saw 3,500 interactions in 6 months. Next slide. Third, our networking services. These relied on our 13 broadcasting partner WhatsApp groups, which now have more than 2,000 participants in total. Staff and local health experts use this extremely accessible channel to facilitate 116 discussions on COVID-19 with broadcasters. Another aspect of our networking services involved a team of 12 local networkers who made daily calls to broadcasters in 20 local languages, informing broadcasters about our resources and supporting their broadcasting efforts to address COVID-19. We made more than 17,000 calls in 5 months to support more than 3,500 broadcasters in 12 countries. Finally, our COVID-19 support funds helped broadcasters stay on air and supported stations programming in response to COVID-19 with technology, personal protective equipment, and more. In total, more than 150 radio stations in 12 countries we were able to support with more than 170,000 Canadian dollars of funding. Ben, over to you.
Thank you very much, Hannah, and how wonderful this project was. And just to sum up, this work enabled more than 1,000 broadcasters throughout sub-Saharan Africa to serve their listeners better during the first year of the COVID-19 pandemic. And I believe that this result, there is a result that shows that yes, the listeners and the radio presenters themselves benefited enormously from the work that we did, as you just sum everything up for us. For example, we conducted a quick survey at the end, and we had 90% of respondents who are broadcasters mentioned specifically that the Farm Radio International work that we did had helped them to increase their capacity to respond to the pandemic effectively as broadcasters, that they were able to support all the listeners, they were able to support themselves in ensuring that the right information is given. Why does this matter? So why is it important for us as an organization and for us to take advantage of this medium? I think in times of crisis, rural African communities tend to radio, and this cut across the whole of sub-Saharan Africa. And they tend to radio because it is a trusted source of information. One of the recent research conducted in Ghana by the Statistical Service indicated that majority of listeners interviewed mentioned radio as their first source of information, followed by television and other social media platforms. And in terms of trust of the information received during the course of the period, they mentioned the information source from radio and television as one of the most credible source of information. So that is why we believe that radio is a trusted source of information for our listeners. Complementary radio by the ICTs also enable radio to become more and powerful tool for communication, for development, to respond to the needs of our listeners. Why is radio very important? Why is radio very important in this equation? We realize that radio works very well because when it comes to radio, listeners are able to receive feedback, they are able to ask questions, they are able to close the end of all the issues that they have, because during the course of a radio program, they have the opportunity to ask questions. They have the opportunity to also listen to extensive explanation from their listeners. And the work we did during this period, we use the interactive voice response system and also the Uliza that allow listeners to leave questions for resource persons, and at the appropriate time, these resource persons answer this question. And all radio programs are also, because, for example, in Ghana, you have more than 450 radio stations. So wherever you are, all that you need is your gadget, and you can tune in and listen to radio. And listeners are able to listen, selecting the radio station of their choice. And one of the things that we also realize that radio does that makes it very, very much important is that it allows for in-depth discussion. In-depth in relation to the topic being something that is very new, something that COVID and COVID pandemic, but because of the opportunity given to a resource person within the time frame of a radio program, there is a very good conversation that allow all the panelists to be able to explain things into details in the local language. In addition to that, right people from the localities are also involved. And among all this, I can say that radio is very agile, because whenever there is a program, thousands of people listen to it, and at the same time, they are able to change the information in response to the needs of the people. This allows as many people as possible to receive what information they need from their locality within the shortest possible time. Within the period, what did we learn? I believe that there has been a lot of lessons from this, and among them, I just want to talk about this as one of the key ones, that a lot of myths and misconceptions and misinformation were addressed during the course of this period using radio. And radio are great place for dispelling misinformation, because what happens is that it is not just stating the fact, but a lot of opportunity. So as we are entering into the vaccine period, and there are a lot of more issues coming as a result of the use of vaccines. So radio will be very relevant. It is also important to notice that working with the right organizations, for example, in Ghana, we had the opportunity to work with the Ministry of Health. We also work with other NGOs within the health fraternity, and they provided the right resource person. In the coming period, I think with the vaccine, we still need to be working with the right institutions to allow us to present the right information to our dear listeners. Another thing that I noticed as a lesson is that a forum of public health information was also tackled in a locally appropriate way, because we had people who are coming from the various organizations on the ground, and they were able to speak to the issues and provide the right information that is needed. And I would say that the African continent has a huge challenge and facing us as we introduce vaccine. And we will have to continue to use radio as one of the ways by which we will deal with this. When it comes to dealing with such interventions, I believe radio will be one of the tools that will provide all the necessary opportunity for all to listen, share and then also receive the needed knowledge. Thank you. I now hand over back to you.
Thanks, Ben. Excellent. Thank you so much, Hannah and Ben, for that presentation. As you can see, there's a lot of information, a lot of lessons learned. If, for those of you who are joining us, if you have any questions for our speakers, you can put them in the Q&A feature of Zoom. And if you're joining us on Facebook, you can include them in the comments. All of your questions can go there. And we have a few team members at Farm Radio who are sorting through those questions, and we will bring them over to the panel discussion after the presentation. So moving on to our second speaker, we welcome Salakshana Gupta, who is the Regional Director of Vmware for Southern Africa. Salakshana has over 14 years experience as a journalist and social and behavior change communications expert. She has designed and delivered high-value, multi-year media for development projects in East and West Africa, working across many thematic sectors as well. She has helped conceptualize innovative multimedia programming and outreach strategies And Salakshana has previously managed BBC Media Action's governance and health projects in Sierra Leone and South Sudan. She is currently the Regional Director for Southern Africa at Vmware. And Vmware improves lives by providing and gathering critical information via simple mobile phones through mobile-based behavior change campaigns, remote training, and feedback mechanisms to really meaningfully engage the most hard-to-reach populations. Salakshana, thank you so much for joining us today, and over to you.
Great, thank you so much. Let's go to the next slide, please. So first of all, to set the stage, I wanted to really contextualize why are we talking about mobile and communicating information and gathering feedback through mobile. Now, these are some stats from the GSMA. And by 2025, we're going to have about 614 million unique mobile phone subscribers in sub-Saharan Africa. So together with radio, mobile is becoming another trusted information source for people, while previously, it had just been seen as a device for making and receiving calls. Next slide, please. So the technology that Vmware uses is primarily known as interactive voice response, or IVR. And this is really simple and similar to calling your bank and encountering an automated voice menu, which says, press 1 for English or press 2 for another language. And you basically interact with the menu based on the options that you hear. Now, what are some of the advantages of this kind of interactive audio communication on mobile? First of all, literacy rates in sub-Saharan Africa are still quite low. Interactive audio on mobile has the ability to communicate in local languages. We can reach any phone on any network. And one of the big advantages is the agile nature of interactive audio on mobile and the fact that it can be set up very quickly in a few weeks. Next slide, please. So at Vmware, we basically have seen are seeing our COVID response work in 2 phases. So the first phase was 2020, where during the first wave, we supported our partners to respond really quickly with community awareness, rapid remote training of health workers, of frontline workers, and surveying of attitudes and perceptions around COVID. And I'll come more to what we're currently doing, but before that, could we go to the next slide? So just to share some stats with you here, in 2020 alone, over 19 million people have heard COVID-19 information through Vmware's pre-recorded voice platforms and SMS platforms. And they've consumed over 222 million minutes of content just on COVID. Next slide, please. And next. So I just want to briefly touch on what are some of the Vmware solutions that we've leveraged here. And the first one I want to talk about is the 3-to-1 service, which is a strategic partnership with mobile network operators in 18 different countries. And because of this strategic partnership, the mobile network operators give us free calls to set up a national toll-free information service, which is really like the Wikipedia for basic phones with access to information on a wide variety of topics in local languages. So how were we able to use this? We partnered with WHO and the Ministries of Health in different countries, 19 countries, and we were able to rapidly launch COVID-19 information in under 3 weeks. Now, this content has been accessed by 6.8 million households in 2020 who listened to over 70 million messages by proactively dialing in to our 3-to-1 services. The content is really varied. In some countries, we've had straight messages on COVID-19. In other countries, we've had interactive path-based games. And in yet others, like in Malawi, we had a really innovative symptom checker where, going through a triage of questions, people were put into low risk, medium risk, and high risk categories. And then this information was shared with the Ministries of Health. And all of this we were able to do on the 3-to-1 services in partnership with organizations like UNICEF, CARE, CHAI, just to name a few. Can we go on to the next slide? So from this national level information dissemination through the 3-to-1 service, I want to talk a little bit about the more targeted training that we were able to do, again, through mobile. So using a solution we have called the remote training service, we were able to convert a curriculum that we developed together with the Stanford Center of Health Education for community health workers. And these were bite-sized interactive audio lessons of about 5 to 6 minutes that were delivered to health workers' mobile phones in the form of pre-recorded audio calls. In 2020 alone, we trained over 100,000 health workers at approximately the cost of $2 per community health worker. So again, pretty cost effective. And once again, we were able to set these up fairly quickly in under a few weeks. And some of the partners, again, we worked with on these sort of remote trainings are World Vision, UNICEF, and also RTI. And then from training, I want to talk about, let's go to the next slide. Talk a little bit about how we were able to rapidly collect data. And so Vmware does surveys once again through interactive audio on mobile, where we are able to take a questionnaire, convert it into an audio survey and send it out directly to a beneficiary's mobile phone. And so someone picks up the phone and they hear pre-recorded questions and are able to answer them by pressing options on their keypad. And some of the, the successes from 2020 was that, we were able to launch these multi-country polls to monitor trends on COVID-19 in partnership with people like the Tulane University School of Public Health and Tropical Medicine. Through this, we were able to measure knowledge of COVID-19, attitudes towards the pandemic, impact on food security, income, mental health, and all of this is available on our website. And once again, the advantages of this kind of survey methodology is that it's rapid and, can be deployed fairly quickly. On the next slide, I just want to share some feedback from people who've consumed content through our IVR systems. So on the first, you see someone talking about, how we were able to teach children to wear masks, through IVR, and basically this prepared them to return to school. One interesting feedback here, especially from the DRC, and this is not specifically about COVID, but somebody who heard about the Ebola vaccine on our 3-to-1 service and therefore was motivated to go ahead and take it. So let's go on to the next slide then, and let's skip forward to the next one. So now what's the next phase in 2021? So we're really looking at how we can support the vaccination efforts and what will be the challenge that we face. And that will be how to successfully distribute vaccines, how to train health workers, make sure recipients receive all their doses. And once again, we think we can leverage 3-to-1 as a library of content on accurate information, on vaccinations, eligibility, myth busting. We can continue to do these kind of national level polls. And then by leveraging the remote training service, we can continue to train the health workers who are at the front line of these efforts. And just some examples from some of our past work on vaccination. We've worked with the Grameen Foundation to deploy the Ebola vaccine in the DRC and Rwanda, where we've not only trained community health workers, but also have been helping the Ministry of Health to ensure vaccine compliance so that people who've received one dose get a pre-recorded message to receive the second one. And in the interest of time, because I know I've run out, I'm going to stop there. And here are my contact details on the next slide in case you want to reach out and ask any more information. Thank you.
Thank you so much, Salakshana. Very interesting presentation. So much information and lessons learned that we can pull from. I'm sure that for those of you who are listening and watching, that you have many questions for Salakshana. So please put them in the question and answer feature of Zoom and on Facebook in the comments, and we will try to address them either in the Q&A feature or during our panel after the presentations. So our next speaker is Mariana Palavra, and she is the Communication for Development, Social and Behavioral Change and Emergencies Specialist at UNICEF West and Central Africa Regional Office and co-lead of the Regional Risk Communications and Community Engagement Working Group for COVID-19 response. Prior to this, she coordinated the C4D emergency response to Cyclone Idai in Mozambique and led its humanitarian community engagement working group. She also has extensive experience with the UN, prior to which Mariana worked for almost 10 years as a journalist in Macau and Portugal. So welcome, Mariana. Thank you so much for joining us, and over to you.
My pleasure. Hello, everyone. So let's start with the next slide. Exactly making the link between feedback mechanisms and community engagement and how communities engage through collecting community feedbacks. So first of all, by collecting feedbacks, we're actually placing the community at the core of the intervention. But we also understand that we can focus on the themes that are more that concern communities, so then it can inform our interventions. And also by doing that, we can improve on a real time the public interventions. Next slide, please. It also allows us through the feedbacks to understand the rumors and address those rumors that are out there. And also at community level, it can guide the mobilizers, the other frontline workers to how to work with communities. But I think the most important point is basically it builds empathy and trust. And it's basically by collecting the feedback of communities, it's a right that communities have. And it's a responsibility from our side, from humanitarian actors. What can we take it from these community feedback mechanisms? We can look at rumors. So try to understand what people are talking about. We can also get to know the questions that they have, which also help us to understand the gaps in terms of knowledge. Also suggestions that people call and they say, so that is also like ideas that we can actually adjust our interventions through those same ideas. Next slide. but sometimes also have negative comments, and that's also why the mechanisms are quite important, because also sometimes it's the way that we know that there's sexual exploitation, for instance, and other abuses that are reported through these mechanisms. And that we also have some positive and some, people calling and praising the activities is also a way of trying to understand if humanitarian actors are going through the right way. Next slide, please. What kind of channels have we all been using within this region? So I'm not going through the list, but as you might imagine, there's a lot of hotlines that were precisely created for COVID and to collect feedbacks, but also digital engagement. And we mentioned like Vmware was a good example of it. Also using social media research. We actually also collect perceptions and feedbacks through research. What else do we have? Well, something that is very dear to this webinar, which is radio and the interactive radio programs. And also we have the interpersonal communication. So those mobilizers that are on the ground, knocking, doing door to door, and also collecting feedback. Next slide, please. So what we have here, it's basically the community, the risk communication and community engagement working group in West and Central Africa. We, the different members, we have been collecting on a monthly basis all the feedbacks that our country offices, that the countries from this region are collecting. And so at regional level, what we do an analysis of the feedbacks to try to understand the trends, right? The feedback trends. So what you see in this ABC is basically the latest, the trends from the latest analysis, the last 3 months. So we have believed that COVID has ended or does not exist. That's what feedback from communities was arriving to us, also related with some fatigue. Also some comments on preventive behaviors, namely a lot about masks and the fact that people didn't want to wear more masks. And finally, I'm raising attention for point number C because it's very recent and it's like that's where the response is now more focused, which was the questions and doubts about vaccination. Next slide, please. So what do we do in this risk communication and community engagement regional working group? So basically, after doing this analysis, we put together a package with recommendations, with resources, and then we send it back to the countries from the region through the risk communication and community engagement national working groups. And then we follow up with them to see if they have been applying those recommendations and how we can support them. So here are some examples of what we have been recommending and doing as well, to give the example. So basically, we have reviewed a lot of research tools, and particularly, as you might imagine, most of the research that we're doing lately, they do have to include vaccination hesitancy and the new variants of COVID-19. We also make sure to share the results and recommendations of these surveys. They have to be shared with all pillars of the responses, not only about the community engagement partners, it's about the all partners, the surveillance partners, the other ones involved in the response, but also a lot of advocacy that needs to be done with the health authorities, because they are the ones who need to keep communicating in a very clear and harmonized and in the most trusted channels and languages. Next slide, please. And this sharing, this data, epidemiological data that sometimes is not so easy, needs to be transmitted not only through health authorities, but also through traditional social media in a very clear way. We have also, as you imagine, we always had through COVID-19 a disease that none of us knew. Throughout the time, we had to update a lot of questions and answers. And more than ever, we are now doing it actually on a weekly basis, and a lot because of the vaccination and the variants, the new variants. So it's something that we are helping countries to do, but obviously this has to be done more at country level, because they are the ones who understand these feedbacks and how communities are, what are their doubts, right? Where the needs that need to be addressed. What else? Training. We have provided some training to the frontline workers so that they can actually work better with the communities. Next slide, please. Just here to name a few, a very good offline and online risk communication and community engagement course that actually addresses the problems or the issues from this specific region. We have done 6 webinars with media in the region, and they were in both English and French, and were basically, the themes were decided based on the feedbacks we received from the communities. I think in terms of vaccination, a lot of guides have been made recently through us, namely how to manage misinformation. Next slide, please. And social listening mechanism support, so we can understand, all related with feedback, what's going on online, so then we can understand and address those issues that, as I said, lately pretty much related with the vaccination. Next slide, and I think it's the last one. Exactly. What's our, how are we going to move forward, right? What are the challenges? And the challenges are also what we need to focus on now, that on our way forward. Basically, we need to support much more in a concrete way, at least from a regional perspective, the national risk communication and community engagement structures. There's also the fact that within the countries, they are not very much understood. The other pillars of the response somehow see risk communication and community engagement as something not very important, as the messengers or the messaging, which is totally a very limited way of seeing us. The fatigue, we are all tired. You are tired, I'm tired, the communities are tired. So we have to have creative and out of the box and ways of keep the fight while we don't, while the disease is still out there. And I think what is important as well is seeing community engagement. It's not about only COVID, it's about every humanitarian response that might happen, any crisis, whether earthquakes or floods or political conflicts. Community engagement, communities should be in the center. So in our perspective, what we want to do is that feedback mechanisms, other ways, the radio programs, interactive radio programs, and Vmware and other platforms, that they will always be there and ready for whatever humanitarian or crisis that might exist. Thank you so much.
Thank you. That was very informative, very interesting. And Farm Radio International has been a member of the Risk Communications and Community Engagement Group since April 2020, and it's been extremely valuable to us. Once again, a reminder, if you have any questions for Mariana, please put them in the question and answer feature, or if you're joining us on Facebook, in the comments, and we will try to get to as many as we can during the panel portion of the webinar. So our final speaker today is Andy Pattison, the team lead for digital channels at the World Health Organization. And over the last 25 years, Andy has held a range of leadership roles in the digital space. As head of online at the Worldwide Fund for Nature International, he spearheaded the organization's first online fundraising campaign and developed its first web-based projects. While head of online at Credit Suisse Private Banking, Andy designed the company's accessibility standards, allowing blind clients to use previously inaccessible online services. At the World Health Organization, Andy strives to amplify vital public health messages to more people through more channels. During the COVID-19 pandemic, Andy has engaged the digital sector to support the mission and leads the Tech Task Force, which is a conglomerate of over 40 companies working to tackle misinformation, raise quality content, and develop new digital channels. So through his work, the World Health Organization has been able to reach billions of people. Andy has also been the web lead for over 35 emergencies while at the World Health Organization, with deployments to the African region to support both Ebola and cholera outbreaks. So Andrew, we're so happy to have you today, and over to you for your presentation.
Thank you so much for that lovely introduction. Good morning, good afternoon, good evening, wherever you're from. Just a great panel here today, and thanks for the invitation. Really looking forward to talking to you today. Next slide, please. Today I'm going to talk to give you a quick introduction of what we're trying to do at the World Health Organization, talk about the 3 pillars of work which we have in my team, look back a little bit over the last year, the small selection of the projects that we've run. We've launched over 100 projects with tech companies and other channels over the last year. I'm just going to talk to 1 or 2 of the bigger ones so that you can get an idea of what we're trying to do. And then I'm going to look forward to sort of see what is next for 2021. Next slide, please. Before I go into the introduction itself, I've been asked to talk a little bit about vaccines. So I just want to caveat this, that I'm not an epidemiologist at all, but I do want to address vaccines equity, vaccines acceptance, or hesitancy, as people say, just very briefly at the beginning of this. As I checked this morning, the dashboard, 400 million doses of vaccines have been issued globally. So 400 million people have had COVID vaccine, which is extraordinary if you think that a year ago, we were just setting out to develop the vaccine. This is unprecedented speed. It actually means that more people have had the vaccine than have contracted coronavirus, which is incredible if you think about it, because those 400 million people have had the vaccine and about 121 million people have contracted COVID-19. It's extraordinary if you think about how quickly the vaccine has been rolled out. It's equivalent to about 5% of the entire world's population have received the vaccination. It's incredible if you think about it. But the distribution, of course, is very unequal. And this is a big problem and something that WHO cares tremendously about. If you're to think about that 5%, actually 21% of Americans have been vaccinated. 12% of Europeans have been vaccinated, but only 0.5% of Africans have been vaccinated. And if there's something that annoys me more than anything, it's inequality like this. Today, I'm going to talk about our fight against misinformation rather than our fight about rolling the vaccines out. But as I'm talking, do imagine the potential that some of these companies have to change the needle in that space of vaccine distribution. If you can imagine companies like Amazon, Salesforce, Microsoft, TNT, and FedEx, these companies that have got massive logistics powers and delivery powers, they could really be game changers in this space. So today I'm going to focus on my work in digital channels. And as the moderator suggested, my job is to get more health messages into more lives through more channels. And obviously, during the pandemic, the goal is to protect people, to save lives, and to bring this pandemic to an end as soon as possible. For me, it all started in February 2020, when I convened a meeting in Silicon Valley of the tech industry and brought them together, and had a second meeting in Seattle to capture other technology giants to tell them about this area of work. So the 3 pillars of my work are raising good content, we're fighting misinformation, and we're exploring new channels and tools and insights. I'll run through those quickly, but before I do, I want to say why this is so important. Next slide is fine. Falsehoods, according to an MIT study of about 1 year ago, maybe 15 months ago, falsehoods are 70% more likely to be shared than accurate news. And this is normal human behavior. If you were to go 300 years back in time and you went down to the river to collect water and there was a big bear with his cubs, you would run back to the village and tell them, don't go down to the river, there's a big bear. You wouldn't necessarily run back to say that the flowers are lovely today. So people spread misinformation, people spread bad news, and bad news is often associated with misinformation. Sometimes it's good news, but very rarely. So a false story will reach 1,000 people 6 times quicker than a real story. It seems that false stories outperform the truth in every single subject, including business, terrorism and war, politics, as we saw last year, technology, entertainment, but sadly also in our case, health. Falsehoods seems like we can simply not compare with hoax and rumor. So falsehoods travel further, faster, and deeper than the truth. Next slide. So what we're trying to do today is trying to get our content into people's lives in your language, in the palm of your hand. I'm going to give you two quick examples here. The first example I want to give you is Google search. If you go to Google now and you do a search for coronavirus or COVID or any related terms, 30 related terms, you will get an experience which is not normal Google search. You will get, it's called an organized search results panel. This is curated news, which means that we are in charge of what news goes up there. Well, we're not in charge. We advise Google of what would be the right approach. They're responsible for this. And that's how you will get an experience where you get global content and local content. The second example I will give you is we have on Facebook a COVID information center where we have placed a lot of WHO and Ministry of Health content. We always try to raise Ministry of Health content. Where Ministry of Health doesn't have that content, WHO will fit the gap. Next slide, please. To fight misinformation, what we're trying to do is to get into people's journeys. So on the average smartphone, we have 30 apps. What I'm trying to do, however, is get into the 4 apps that you use every day, whatever they are. So we're not trying to drag people in WHO's channel. What we're trying to do is get our content into people's existing channels. So what we do, like my colleague from UNICEF just said, we create mythbusters to destroy the myths which are circulating. We do report every single problematic account that we see, and we have to give reasons why. But some of the most interesting work that we do, although not very glamorous, is working with policy teams. So we are working with the policy teams at YouTube and Facebook and Twitter to make sure that their policies are fit for purpose around health matters. We're trying to make sure that they can police their own sites. So we work with the policy teams so that they can improve their policies so that they can remove more content. Next slide, please. Tech companies give us lots of insights into user behavior, which we share as much as possible with the community when we can. Sometimes they give it to us and they only can keep it for ourselves. They're also helping us deliver content to people where they least expect it. As a person just before me spoke, people have got COVID fatigue. We need to figure out how we get them to listen to COVID messages. We're no longer talking about just washing hands. We have to become very innovative about this. I can talk to some of these examples in the Q&A if of interest, but one of our main channels and new channels that we launched was our chatbots initiative. The WhatsApp chatbot was one of the largest that's ever been launched on WhatsApp, certainly the largest, with 30 million people subscribing. Sorry, 13.5 million people have subscribed to the service. We have another 5 on Viber and Messages bots as well. And we're very happy to work with Free Basics, which is an internet service which provides zero-cost data for users to access health information. And that's currently live in 50 countries and 6 languages. We also, as mentioned before, partner with Vmware 321 and hopefully launch vaccine content in the coming weeks with them across their service. Next slide, just to give you an idea of what some of these products look like. This is our chatbots. Next slide. This is how Google Ads will appear. Google Ads is very interesting. If somebody is looking for content, which normally they would never find WHO content, for example, if a president of a country had done an interview with Fox News to talk about hydroxychloroquine, if we put Fox News, Trump, and hydroxychloroquine, nobody would ever find WHO content. What we do is we serve an ad to talk about vaccine safety or the cures for COVID. Next slide, please. This is a small gamut of the people we've worked with, some really big names. Globally, we've worked with people in every single continent, of course. Next slide, please. Another example of just the numerous products we've launched with Google, which is by far our best and biggest and broadest partnership. And then finishing off on the next slide, I want you to just think about magnitude for a minute. If we were to, we talk about millions and billions, and it's very hard for the human brain to comprehend that. So we are reaching billions of people, literally. And if you put that into seconds, 1 million seconds is 11 days. 1 billion seconds is 31.5 years. It's a long time. It's a lot of difference. When we're talking about billions of people, we really are reaching them. So next slide. What is the future? Everything we're doing for COVID, we're planning for the long term. What does that mean? It means that we are trying to find ways that we can talk about other health emergencies and also health issues such as obesity, access to medicine, diabetes, heart disease, physical fitness, diet. We're hopefully planning the future. We want to use COVID as a catalyst for the future. We also have to spend a lot of time in the next few months evaluating our products. We have to, so what if we've reached 1 million people? We have to evaluate them. We have to carry out peer-reviewed papers. And of course, we're forging new partnerships to fight vaccine misinformation, which is the new battleground. And one of our big areas of concern is tackling misinformation, especially around vaccines, in communities of color. What we've noticed is that vaccine misinformation is mostly right-wing, generated by white people in middle-class suburban Europe and America, but the impact of that misinformation is felt the worst and the most in countries of low middle income and low middle income communities, as well as communities of color, wherever they are on the income scale. So we're really taking these places very seriously. Next slide, my last bit. This is something that we're rolling out now on smart and dumb phones. We're rolling out rich text messaging on smartphones, on dumb phones, simple text messaging. We started rolling this service out with the mobile operators. So far reached about 150 million people globally. The idea is that we'll keep churning those out at about 150 million people per quarter. And so it may arrive on your phone one day and that you'll know that it came from one of the guys in my team. And I can keep talking about this, but let's skip over the gaming industry because I'm running out of time. So I hope that today's given you an insight into the work we do at WHO and that you've seen that we can engage with the private sector. And one thing that I would really like to say is that I'm delighted to see traditional competitors working together to save people and keep the world safe and protect the vulnerable. Thank you very much, and back to you.
Thank you, Andy. Insightful presentation on behalf of the World Health Organization, and so much information. Each of our presenters today, I'm sure could have spoken for many more minutes, with everyone extremely interested in everything that we're sharing today. Farm Radio obviously looks to the expertise of global and national health institutions to guide and inform our work, and especially as we enter the next phases of the COVID-19 pandemic, all of this information and this collaboration is incredibly important. If you have any questions for Andy, please insert them into the question and answer feature on Zoom, or on Facebook, you can add your questions in the comments. So we've heard from all of our speakers today, and so now here's your opportunity to ask your questions. Hopefully you've done so already, and we've selected a few of them so that each of our presenters can answer a few of them. So I'll be choosing some of those questions either from the Q&A feature or from the comments on Facebook. And I will read one question at a time, and I'll address them to a specific presenter. So I'll ask everyone to turn on your cameras so that we can see you as you're speaking. And we have a few minutes for this. I think we had planned for 20 minutes but we may have moved a little bit of that timing. So let's try to keep that in mind when answering. So trying to keep our answers from 2 to 3 minutes each maximum. And are we ready, panelists, to answer some questions from our audience? So I'll start with a question for Ben from Ambika Samartia Howard. Apologies for any mispronunciations. So they want to know, I know videos and TV are also very effective forms of agile communications. So how would you compare the pros and the cons of videos or TV versus radio?
Thank you very much for the question. And I will say that when it comes to video, the need for the script writing, making sure that the set is ready to enable the video to be captured takes some time. But with radio, you have your script, it goes into recording and quickly it goes out, or it can go out live if you know that the right information is being delivered. And then also when it comes to television, in Africa, we don't have power everywhere. So it is easier to just use a battery for your radio as compared to television in terms of reception and also the ability to get this people receiving television all the time. And then people working also can still listen to radio program wherever they are. But sometimes television, you need it at a particular place. So farmers, for example, cannot have their television when they are going out. Thank you.
Thanks, Ben. So a question for either Mariana or maybe Andy, depending on how you feel about the question, but have you seen, this question is from Frank Schneider, have you seen national governments in the targeted countries seek support for the next phase, or a desire to use the new tools in their efforts to address not only COVID-19, but also some of those other health priorities?
Can I?
Of course, please go ahead, Mariana.
Yeah, I've seen. I must say that we, at regional level, we contact at least twice a month all the national authorities. They are leading the risk communication and community engagement. And we have done whether trainings, because they ask so, because they ask to be trained, particularly on community engagement and on feedback mechanisms. And so everything is demand-driven from the countryside. It's not imposed by us. Another thing, they have been shift and adjusted, like they, probably half of the countries in this region, they have reviewed and adjust their risk communication and community engagement strategies. Precisely, one of the main points was actually the vaccination, the introduction of the vaccination. And talking about that, so there's also countries that are now introducing the vaccine. They did a particular, a specific plan, communication plan for the introduction of vaccination. And they actually have asked us a few, at least for the time being. I think we have reviewed at least 5 countries who asked directly, ministers of health, for us to review and see what we would think. All the axes of intervention were there. And these are all adjustments. This is something from the last 3 weeks. So it's quite encouraging what we have been doing with them, and the fact that the countries are kind of, I wouldn't say asking for help. It's more like asking for coordination, right? Asking for, sometimes we're just connecting the dots. We are no better than, we can never replace the countries, right? Because we are too far, we are in a regional platform. But what we can do is basically sometimes we say, look at Nigeria, what they've done. And I think it's probably for Ghana. Maybe you want to share these ideas, and we are kind of connecting the dots, being like the maestro, the conductor of the music. So yes, quite happy. But it's all about trust. The same way communities have to trust humanitarian workers, or government addressing COVID. Also, the governments in each country, they have to trust us at regional level. And this was not easy at the beginning. There was a lot of back and forth. They needed to understand that we were not just saying, oh, we want to help, that we were providing resources and we were making ourselves available for whatever they thought it was needed. Thank you.
Thank you. I think that speaks a lot to the incredible collaboration that's happening and how we're seeing it as this global or regional, that we cannot simply be looking at our projects and our plans to move forward. We really have to work together. And it speaks also to, you're talking about trust, to what Andy was saying around misinformation and some of those inequalities that that some countries are facing, and the importance of working together on those things. A question for Salakshana from an anonymous attendee. Do you have any insights on how effective your programs are towards reaching and impacting vulnerable populations? So women, refugees, people with disabilities, people with less access to perhaps some of those technologies.
Yeah, so I'm happy to answer that. So I guess it really depends on the type of solution that we're implementing. So sometimes, for instance, we'll be asked by our partners to carry out a remote training for a very specific population, which might be a population in a refugee camp, or it could be frontline health workers or teachers. And in that case, we're able to, by doing IVR surveys, pre-recorded voice surveys, we're able to gather feedback and understand how the information impacted them. For our training solutions, we also build real-time dashboards where we're able to see, by disaggregation of data, by gender, age, what the uptake of the content was, what the response rates to the knowledge questions were. So that's when we know the audience that we're already communicating with. With services like the 3-to-1 service, which are, more like, the mobile version of radio where anyone can access it, by proactively dialing 3-to-1 from any mobile phone, it's a little bit trickier to know exactly what the profile of the person calling is. So we do have some registration questions that we ask people, which are pretty basic and non-invasive. We're just gathering information on age, gender, and location. And then in a number of cases, we regularly survey people who've accessed this information to then, get real-time feedback on how useful the information has been to them. And we've done this a lot around COVID, where people have answered a number of surveys, as I mentioned, on a wide variety of topics after listening to content on the 3-to-1 service. We can sometimes put in, a question to try and probe on what their specific profile is. For instance, do they have a disability? But it's not that easy. So yeah, so I would say that our ability to determine the impact of our information and services really varies by what solution we're implementing.
Great, thank you. And you used the term questions that are non-invasive. And I think for all of us, that has been such an important thing to think about, is we're trying to learn about the audiences that we're having conversations and dialogue with, and we're collecting a lot of information. But how do we make sure that, ethically, that we're moving forward in a responsible way? Thank you, Salakshana. A question for Andy from Isaac Ampoma in Ghana. how can we encourage positive news among the religious community? And also, how do we help resolve misinformation on different platforms, but specifically WhatsApp? And then an extension of that question along those same lines from Francis Kostick. I understand that some churches harbor large populations of vaccine hesitancy and likely some misinformation. So church leaders are hugely influential and may base their position on religious doctrine. So how do you convince them to change their beliefs or the way that they communicate about COVID-19 and provide their congregations with the correct information, prevention, and then seek vaccination where possible?
So two excellent questions, and I will answer the religious situation first. The World Health Organization convenes religious groups to talk about this, part of our risk communication strategy from all religions. And they are mega influencers, all of these church leaders and churches themselves. We try to encourage the spreading within their groups of positive and healthy information that's correct. And we also offer education processes to people of any denomination to learn about why misinformation spreads so quickly and why people get the wrong end of the stick sometimes. So we have several projects with community leaders. For example, one of the things we do is debunk myths which are specific to some religion. There is a myth which is going around which says the vaccines, for example, are not halal. So we have worked with the British Medical Muslim Association to debunk that myth. They have gone through all the correct checks and they have published a paper to say the vaccine is indeed halal and has no animal products in it at all. And we do that for all of them. So we try to find the specific the specificity of the problem to that religion and then deal with it and debunk that to help them. People will listen to their governments a little bit, to their news outlets a little bit, but what they listen to most is influencers, whether they're religious leaders, cultures, pop stars, football players. We have a whole program of talking with influencers. Very quickly, with regards to spreading misinformation on WhatsApp, it's very hard to stop that. The reason is it's between two individuals. It's called peer-to-peer. The spreading of information from one person to another person is like a phone call. It's absolutely private and we cannot and will not get involved in that. What we can do on WhatsApp is work on their policies, and we have had success with them, to reduce the speed you can spread videos, the speed you can spread photos. Now, when you want to forward a video, you can only send it to one person. So it takes you a lot longer. A year ago, you could send it to everyone in your address book. So things went viral very quickly. On the other hand, it's interesting with WhatsApp to work on making your post more viral. Actually encourage people to forward it to 5 friends. And hopefully the good messages will eventually outnumber the bad messages. I hope that answers your questions.
Thank you. To continue on a little bit with the types of conversations that people are having and the importance of that peer-to-peer influence and to stop misinformation. A question for Ben. Could you elaborate on how people can use radio programs to have these kinds of more in-depth conversations? Radio can be a one-way medium, but everyone here has talked about how we have these feedback loops. So, or opportunities to have those conversations. So how does that happen on a radio program?
Thank you very much. With the use of the interactive radio approach, we make sure radio programs are combined with a mobile platform with support from Vmware, which we call Uliza. This allows us to ask questions even before the program, and this allows listeners who also want to interact with the radio program call the Ulisa system, and this allows them to, one, answer the questions that we put out to them, and then also it allows them to leave their own set of questions, comment, and contribution to the program. And the good thing is that the radio team has the ability to listen to all the voices, and then they categorize them and make sure they bring the right resource persons at the right time to respond to all these questions. So there is a complete feedback loop that allow the questions that were that people may not be able to ask during the course of the radio program to also come into the conversation. So this helps as many people as possible to have their questions answered when the program goes on. And this is before, after, and after the program. Thank you.
Thank you, Ben. A question for Mariana from John Van Mossel. Is the information collected through CAP surveys, so community feedback or other data collection channels, likely to be useful for other public health uses? And do we know if it's more about rural dwellers or urban dwellers?
Yeah, totally useful, particularly because, and I don't know if I mentioned, but a few countries like Burkina Faso, but it's not the only one, they actually have seen, and it's not something that happened in the last month, since the beginning, because they had other outbreaks and they have a humanitarian situation. They understood that they have to have integrated response. They couldn't do only COVID. They didn't have nor the resources, nor the access to certain areas. So it was always, particularly in terms of health, it was integrated packages that had, and you have to think that they had several polio campaigns, they had measles outbreaks, they had COVID at the same time. Now they have vaccination, but also they have other vaccination campaigns. So this integrated way of seeing it kind of went through the all pillars of the response, including risk communication and community engagement, which means that whatever social science research they did, and they did a few to understand perceptions, it's not only about what people knew about COVID, was also what people fear about health services. What was the impact of the continuity of care? What was the impact on the other, GBV, on gender-based violence, for instance? What COVID could the impact on these other areas that that obviously then fed the different programs and different organizations. Having said this, that's also why we mentioned that whatever study is done that is born within these community engagement actors, it's necessarily, the recommendations have to be, first of all, operational, and they need necessarily to be shared with the other pillars of the response. And particularly in countries where we have the so-called clusters, where we have the nutrition partners meeting together, the protection and the child protection subgroup meeting, regardless if there is COVID or not, these kind of studies and results, they have been shared. Then, of course, you might say that in certain places, certain countries, maybe they were shared, but maybe the recommendations not necessarily well implemented. Then we would have to see, we can see case by case and country by case, by country. But yes, I have seen the whole idea that we do an assessment where we put only what you know about COVID or something, that's not even useful anymore. We don't know. In terms of awareness, people know. It's more than that. It's about the social economic impact. It's about the continuity of services, health services and other care services. Mm-hmm. It's about gender-based violence, as I mentioned before. But yes, absolutely. It has been very useful, and it's the way forward.
Thank you. So I think we have, let me just double check here. I think we have one last question. So perhaps a question for Ben or Andy. You can see as I'm asking it, but when we're talking about misinformation or hesitancy and things like that, the same applies to some of the good stories in development news that are sometimes neglected to favor the negative scenarios. So we have to educate the media to make more responsible actors in supporting good communication in influencing public opinions. So this question is from Ricardo Del Castello. Are there any initiatives currently that are doing that, that are talking about some of those, some of the good stories, the successes that we're having?
Yes, I'll quickly answer, then hand over to Ben. From WHO's point of view, we recognize that the reporting of the pandemic from journalists was very poor at the beginning. So we put in place training programs with universities. And for example, with the University of Texas, we trained over 3,000 journalists on how to report on the pandemic and how to report on the numbers. We have all seen in the last 12 months a huge growth in amateur epidemiologists, on people who misinterpret figures. Epidemiology is a science which takes years to become a good practitioner. And now on TikTok, on WhatsApp, we have people offering opinions. It's very important that opinions should never trump science. And science has been eroded. And I've kind of avoided the question because humans like bad news stories, unfortunately. That sells more than good news stories. But there are some journalists who do it very well, and at the end of every program will end with, and some good news, and that's what we need to see more of. So I fully agree, and we wish we could do more in that space.
Thank you. Ben, did you want to add something?
Yes, I want to add that in the work that we did, we tested various ways by which we can reach out to journalists. I know in one forum, an INGO forum, I was asked, why did you choose journalists among all the population? And we mentioned specifically that one journalist trained will be able to provide information to thousands of people. And then also a bad journalist can also destroy a larger population because of the resource that is available to him by the power of radio. So we focus on journalists by providing them with broadcaster resources in the form of how to design an emergency response radio program. We also provided enough information in terms of background information that will allow them to research and provide the right information. In addition to that, we also tested the opportunity for broadcasters to participate in a question and answer session or an e-discussion on WhatsApp platform, where we bring various resource persons and allow the journalists to ask all questions that they may be having, and then allow all of them to learn from each other's question, and this resource persons respond to them. And this is an approach that has worked, and I believe that we are continuing this in some of our projects. Thank you very much.
Thank you, Ben. So with that last question and answer, we've reached the end of our panel session. So thank you so much to everyone who has asked questions and to our speakers for their thoughtful responses. So one last thing, we're going to ask one last thing of our panelists, and that is to give us some final thoughts, some key takeaways from today, and specifically, the answer to this question. So based on what you've heard today and the questions that have been asked by our audience, where is the international development community going in the next phase of the COVID-19 pandemic? Could there be a larger question? But I think, we have some ideas around integration, collaboration, things like that. So we'd like to hear your final thoughts. We only have about 1 minute for each speaker to give us their final thoughts. So again, the question, based on what you've heard today, where is the international development community going in the next phase or phases of the COVID-19 pandemic? So I will ask Ben to go first. 60 seconds on the clock.
Thank you very much, Sylvie. I would say that the word partnership, collaboration stands out because no one tool or channel will be able to do this. And I can say in our work that we have done, I see a lot of us using the radio, using the social media like Facebook, and also using the mobile platform that allow us to also reach all the unreached. So it is the way forward to collaborate in terms of the various channels and also in terms of the partnership that we need to send across the right information. Thank you.
Thank you, Ben. Salakshana, over to you.
Yeah, so from our experience, we're seeing an increased willingness in the development community to leverage digital solutions. Previously, it was a nice to have on a proposal, but now it's absolutely essential. So, you know, in past years, people would, you know, put just radio into their proposals or just interpersonal communications. But now we're seeing that, you know, as these solutions are being built, they are really multimedia and leveraging every possible communication channel that's out there. And for us, that's a great trend to see.
Thank you. Mariana, over to you.
For me, it's more and more and more of listen to communities. It's to respect communities. It's about empowering communities more than ever. It was always true, but also because of the fatigue and also because evidence shows us that the communities can find themselves the best solutions. So my focus and the future now for COVID, the future for any, to address any emergency, in particular talking about the also emergency preparedness, because we don't want emergencies to happen, we want to prevent them, but the answer is not with us, the answer is with the communities. And to know it, we need to respect them, we need to empower them. And that's it, thank you.
Thank you. Andy, over to you.
I would absolutely agree with everything the other panelists have said so far, the local communities being key. You know, what does a white European male living in Switzerland know about how to communicate in Uganda? We have to listen to local communities, local influencers. I also believe that we have to collaborate much, much wider and much, much quicker and worry less about our own image and our own brand and more about the actual message which is going out. We have to partnership with the private sector who have massively investing into health at the moment and development. And I would love to see, on a personal level, I would love to think that we will respect doctors and nurses more than entertainers and football players in the future. Thank you.
Thank you very much. So that brings us to the end of our time together. And I think, you know, the takeaway is we're talking about integrating different methods of communication. So ensuring that it's multimodal, that we're looking at all of the different ways that we can communicate with people. We've talked a lot about collaboration, the importance of collaborating across different areas of expertise in international development. Andy just mentioned also private and public partnerships and collaboration. So something that we need to strengthen and look forward to even more. The importance of some of those collateral impacts as well, that you know, we talked about the fact that in some places, I think it was Mariana that talked about in Burkina Faso, they needed to look at the different things that were happening at the same time and think about how those areas intersect with one another, and to make sure that some of those some of the ways that we're communicating and dealing with COVID-19 is also looking to some of the other things that are happening in those communities, because they're just as important or they need just as much attention. And then of course, proximity to those populations that we're working with. and reaching people where they are, so that if it's through a radio program, through digital means by using mobile phones, or in the way that Andy was talking about with all of the different places where we find ourselves looking for information or receiving information, those feedback loops, those connections with communities, and how important all of those things are for us to be successful, not just in the next phases of COVID-19, but in some of those other things that we know are coming around the corner. We've done all of this in such a fast way. It's been incredible to see how everyone has switched on and moved so quickly. I think there are still some challenges ahead, but I think we can all think of some successes that we've had and the motivation that we have to continue this work. So thank you everyone who joined us today. Thank you so much to all of our speakers, the panelists, for sharing your experiences, your expertise, and your ideas. Thank you to all of the people who helped bring this together. Clementina, our translator, the organizers, everyone in the background that allowed us to do this today. This is a really important time to reflect on the past year and how C4D has evolved, but also to step forward with stronger, more efficient, and impactful collaborations. So thank you so much, everyone. If you have any questions or inquiries, you can reach the Farm Radio team at either info@farmradio.org or on social media, our website, farmradio.org. Thank you so much, everyone, and have a wonderful rest of your day.
Thank you.
Umesikia? Kikohozi kiaweza kuwa mojawapo ya alama hatari. COVID-19 ni magonjwa inayojitapanya na inashika mafua. Magonjwa haya inajitapanya kwa mtu na mwingine kupitia matoni yenye kutoka kwenye macho, pua au kinywa ya mtu ambaye ameathirika. Kwa kuzuia kujitapanya kwa maradhi ya COVID-19, funikeni kila mara kinywa na pua kwa kutumia kunja la mkono wetu ama kitambaa au tena mshwari tunapochafya au kukohoa. Tupeni mara moja kitambaa hiki ama mshwari ulio